hiding? I mean, you don't have yourself on video cam. Just identify yourself first. You know, hi, this is so and so. Thumbs up.
This is
Great.
Wendy. Thumbs up.
Yay. Okay. Awesome.
Thumbs up, Kathy.
All right. Thank you so much. This is great. So let's get started here. This is pretty exciting. This is actually kind of our first coaching call. We had the intro, a couple of calls, but to kind of sort through where do we want to go as a team, and then we're going to continue with that conversation with some visuals. I hope you all got the agenda and the email in advance. And I would ask if somebody could be a note taker for this meeting, and we are going to rotate that role.
I'll take notes today. This is Maureen.
Thank you, Maureen. Thank you. So I'll kind of keep track of time myself, and help with the facilitation. So the agenda is I'd like to do a little get to know you and talk about what to expect from coaching. We'll do a very brief website tour because you all are familiar with that. And then actually part of one of our goals as a coaching program is that you get really, really familiar with the website so that you can use it with great dexterity after the coaching is done. So I have for each coaching call, we'll be asking one of you each time to, for the next coaching call, bring a part of the website back to the team and say, here's a part that I found, I really love it, this is why, I think it'll help us, blah, blah, blah. So I'll do a quick orientation. Oops, we're getting some feedback. So it might be that, you know, both phone and you might have two audios open if you're getting feedback. Go under audio in the control panel and make sure if you're using the phone call, click the button, the radial with phone call. If you're using computer, just click that one. Are you all hearing echo?
Mm-hmm.
Yeah, that's, I think, because, yeah, we've got phone and computer. Somebody might have both on. And you might try, if you want to look at your speakers on the bottom of your tray of your computer, there should be a volume. Take a look at that and see if that helps. You might want to mute that if you're having trouble. Okay, so then we'll do your coaching goal and look at the visuals that Erin put together, and I think that's a good place to start, and maybe you all can bring forward your visuals if you have any, or we can just talk about those visuals, and then what are the implications for where you want to go as a coaching team, and then we'll do next steps and action items, and then we'll do a checkout with hopes, fears, and concerns about coaching. Is that okay for an agenda? Thumbs up, thumbs down? Okay.
Yes, Ruth.
All righty. So I'd like to start with coaching. Most everybody has been coached in one way or another, and it could be from a sports event, a sports team, could be music coaching, could be a teacher you had, could be a parent. I'd like you to just think about a time that you've been coached and it was really a good experience. And think about, what did the coach do to make it successful? And what did you do to make it a successful coaching experience? And then what were you able to do as a result of the coaching? And this will sort of ground us in what is coaching. So if you could think about that and give you a moment, then I think what I'd like to do is call on people, if you don't mind, to go one at a time. Would that be okay? Are you all okay with that? Being called on? And if you're not ready to go, just say, I'm not ready yet. Pass for now, and then I'll come back to you. So I'll give you another minute to think about that. What did the coach do? what did you do, and what were you able to do as a result? And this is, check-ins are pretty brief. You don't have to give all of the details, all the deets, but just the basics here. So, Arian, would you be ready?
Yeah.
Okay. So let's start with what your coach did. And I'm going to take notes on the slide. You'll see it come up there.
Sorry, my internet isn't.
I can hear you.
It's a little choppy on my end. I'm sorry, can you just repeat that last little bit you just said?
I am going to take notes on the slide just to capture some of this.
Great.
What did the coach do?
So he was my soccer coach in high school. So, and I was goalie. And so the coach pushed me to do some of the scarier things as a goalie, which was, falling off to your side if you weren't sure if that was where you wanted to go. And so he challenged me to step beyond my comfort zone. And what I did to make that happen was trust him. There was a lot of trust there. But also I committed to making those, to putting myself in those positions because I knew by doing so I'd become a better. That's it.
Thank you. And as I'm typing here, if I didn't catch what you meant, any of you just correct me. Kathy, you're next in the alphabet. What did your coach do?
My coach actually worked with me to identify what goals we had, and we wrote it down very specifically.
Okay, and what did you do?
And I actually did homework in between our coaching meetings.
Okay, great. Chris, how about you? What did the coach do?
I was on a swim team that the coach set the workout schedule and really helped refine the techniques. And then I showed up and worked as hard as I could at practice.
Okay, thanks. Erin, how about you?
I think the most recent coaching experience is fresh in my mind. We're being coached in the implementing a primary service provider model for Help Me Grow. And the coach has been helping us identify, helping us with clarity and perspective, helping us identify and flesh out our barriers to implementing a technique, and then pushing us to develop that plan to move to the next step. I think it's been helpful to have somebody from an outside perspective help us see where we are in the process, but also reminding us to set those measurable goals. And so we've been setting measurable goals and then reporting in on those on a regular basis.
So what you've done is following the plan and reporting in on the goals? You're implementing the plan? Okay. Okay, great. By the way, if you're not speaking, one way we can, I think, cut down on some of the feedback would be if you know how to mute your own audio. Do you all know how to do that? You go up into the attendees list and you can actually mute yourself. Yeah, that'll cut down on the feedback a little bit. Maureen.
Okay. I think about human resources or supervisors training and specifically around communications and how to be a good listener, how to be an active listener, using restatements to make sure that what you're saying is received by others the way you intended. So we practice that, and it's something that I need lots of practice on.
Don't we all? Thank you. And then what did you do? You practiced it?
Yes. With my own staff, it's something that I have to work
You're
on.
back in the workplace.
Mm-hmm.
Mm-hmm.
And I think it's something that everybody has to actually work at.
Mm-hmm. And Ruth, you're next.
Okay. I had a coaching experience with the Center for Creative Leadership, and one of many things that I learned from my coach was to lean into my discomfort. So be willing to do things that wasn't particularly comfortable with, and what I was able to do is look for ways to do things differently with new partners.
Mm-hmm. Thank you. And Wendy.
Well, as I think through a coaching experience, I keep landing on the fact that the most effective coach helped me validate that I was on the right track. And as a result, I worked harder toward my goals.
Mm-hmm. Great. Well, obviously you've all had experience with coaching, so that's going to be a wonderful perspective coming into this coaching program. I would say that everything you have on the right-hand side those are some things that I can do with you. You talked about challenging you into your discomfort zones, identifying goals. We've got a schedule of calls and sort of a workout plan, if you will. We'll have a workout plan. I can be a thought partner with you and reflect back what I'm hearing. There might be some teaching in there. Well, we'll go into the Action Center, maybe take some tools out of there. You actually will have an opportunity, if you'd like, you can use the Boundary Spanning Leadership Toolkit. We have licenses for each one of you. As being coaching community members, you have not only access to our Action Center, but all these other tools for collaborative work. And
What's that called?
it's called the Boundary Spanning Leadership Toolkit. And on one of our calls, well, I can take you in on this call if we have time. I can show you what it looks like. And each one of you can have a license for that. Boundary Spanning Leadership. Because that's what we have to do when we're working cross-sector, is cross boundaries. Make a note of that. And then, yeah, and validating and confirming and encouraging. That's a big part of what I hope to be able to do for you all. So hopefully you got a little experience of what that feels like in the initial calls. We've now had a couple, and it's really not about me giving you advice and telling you what to do. I think you saw the opportunity when you're all, and it's very common, you're in exactly the right place, but you're trying to sort of wrap your heads around, different people are coming into this challenge area with different mental models, and you're trying to wrap your heads around that. So my job is to reflect back to you what I heard, and then you push back to me, now this is what we're hearing. And so that's what it's about, is really reflecting back, but not telling you what to do. I hope you experienced that in the last call and then email, and now this experience here today. So that's that. You know, what is coaching? Do you any questions at this point? And because I'm going to give you a little bit more about what to expect from this coaching program. Any questions though before I go on? Okay. So I just, Chris, you actually met some of these folks. Like you met Kitty down in Tallahassee. That's me, my blue. Who else was down there? Allie and Mary and Jerry. So 4 of us are in Madison, and another 7 of us are around the country. So we have 7 regional coaches, and I started with the program in 2011, and then we hired the additional 7 people in 2015. And we come from all different disciplines. My background is education. Some of us come from public health, some social work. Jerry's a lawyer, urban planning, and healthcare. So a lot of different perspectives. But all of us share a knowledge of process, collaborative work in communities, the Action Center and the whole website, moving from data to action, and all of us will bring a bias toward working toward policy and systems change, because that's part of our 10 principles. And of course, the coaching is paid for through Robert Wood Johnson Foundation, but our program is actually based at the University of Wisconsin. So we are not RWJF coaches. We are County Health Rankings and Roadmaps coaches. So we are not RWJF, but we partner with RWJF. They fund the whole program. But we are a research institute, and that's an identity that I think is important, because we can bring some evaluation and research to this whole enterprise. Our coaching network is pretty wide, so I'm not going to go through what all the different stars and blue dots and everything, but some of them are quick response to coaching. Some people just have it for 3 months. Some people have it for longer, 1 year. Sometimes it's individual, sometimes it's team, sometimes it's a cohort. You folks are in a cohort, the RIC cohort. All of the coaching teams and individuals have an opportunity to have access to peer learning network opportunities, and one of my jobs is to connect you to other communities, sometimes to a prize community, culture of health prize community. So that's one of my jobs, is to be a connector. Also opportunities for funding that might come along. There'll be some new opportunities for that as well, to further support and leverage your work. Our goals are, wherever you are, to help you either develop or get more sustainability around these items here. So I'll just let you read those. Let's see if you have any questions there. All good? Let's see. You'll have to speak up, because while I'm sharing my slides, I can't see you. Oh, there you are. Okay. So this is what we measure our success with you all, and it won't necessarily be in all of these, but it may be one. So one of the things that I heard from you all in the initial calls is it's really important for you to have this. You've got wonderful programs and assets and resources in your county, and what you, I think, are talking about doing is bringing them together in an even stronger multi-sector partnership where fewer silos. I love this analogy. It's like you're in traffic. You want people in their lanes, but you want to be able to cross lanes without bumping into each other and then go back into your lanes, but you're all on the same highway going the same direction. And obviously with the increase of health equity, so children in poverty being a main focus here. My role, as I mentioned, I have multiple hats, taking you into the Action Center and into the website, being a thought partner with you, connecting. being a neutral outside observer, one of the things you get with this coaching is you can have a site visit if that's something that you think would be helpful to you. And I can come in and observe a meeting, or I can help you facilitate something. I can be a co-facilitator. We could talk about that and when that might make sense. And being a skill builder, skills and capacity around boundary spanning, for example. And some of the tools will help you do that, and I can help you kind of increase your muscle strength around those things. Here's what you can expect of me. I will provide guidance and support, questions, connections. I said before, I'm not going to tell you what to do. So if you send me something and say, what do you think I should do here? I'll say, well, what do you think you should do here? What are the questions you're asking, and how would you know what to do? And, you know, more coaching type questions rather than, you know, advising you. I'll try not to do that at least. I have a tendency to move into that. So if you hear me trying to tell you what to do, be sure you give me feedback and say, now, Jan, is that coaching? Or if it's not helpful to you, tell me. I really want to be open to your feedback in the moment or after a call. And I will help you hold yourselves accountable for the steps that you want to take. So whatever your plan is to achieve your coaching goal, that's a big part of what I'll do. And I think you mentioned that on your coaching experiences. That was something your coaches do. So as far as these call expectations, we've set up monthly calls. You don't have to have a monthly call if it doesn't make sense. And I've had teams, I'm working with one in New Haven right now, they needed December to kind of get some work done and get some things together. So we didn't have a coaching call, and we put it off to January, and that was fine. So you can, you know, if you want to make good progress on your goals, you're probably going to want to make sure that this team, which should be a subset of a larger group, is working with that larger group and is advancing the goals of the group. That it's not just, the work is not necessarily going to happen just in the coaching time that we have together. And I talked about feedback. Please give me feedback. Be open, be honest, and then hopefully we'll do some reflecting all along the way, because I really want to help you build your reflective muscle too, because that's how things keep getting better. And we may not have decisive solutions at the end of each meeting. So it's sort of living in the question rather than always in the answer. And sometimes that's not real comfortable for people. So that's the leaning into your discomfort zone part. that may happen. So just know that may happen. Your commitments, I think I have commitments from all of you, so thank you so much. Are there any questions about these commitments? Any worry that you won't be able to? Oh, Kathy, thank you for your chat there. I just saw it. So if you want to chat your answer to me too, that's okay. But I think by signing the commitments, I just, you know, it seems like you know what you're getting into, but sometimes you'll get into it and it'll be, oh, I didn't think it was that. So again, we can talk about that as we go forward. But for now, it seems like this will work. So yeah, this is a goal-focused program. You talked about goals with your coaches. So one of the things I'm going to be asking you to do is not just imagine 12 months out, because that's sort of your coaching goal. You have a coach for a year, but we're going to be envisioning for your community, if you're doing things, if everything was going right, if you will, what would it look like? And what does success look like? And then we're going to back off from that community vision, which will probably be a several years out kind of vision, back that up into, well, what could be accomplished during this coaching time toward that vision. Does that make sense? Thumbs up? Okay. So with that, I'd like to briefly take us into the website. I think you all, when I asked you on the very first call, and I might have asked it again on the second one as well, whether you were familiar with the website, and you said yes. So you should be seeing my website right now. Is that seeing the County Health Rankings and .org website? Okay, let me know if you're not seeing it. Okay, so just very, very quickly, you know that you can go into your county, see your snapshot. Before we go there, though, I just want to point out how important this is to really understand the population health model here. And I'm going to go over this one quick time here. And the idea here is there's 2 health rankings. Outcomes, so how long and how well people live in your county, and then all these factors, 4 major categories of factors that drive that health. Think of this outcomes as your today's health, and these are factors that drive toward tomorrow's health, and that's why we give you 2 ranks, today's health and tomorrow's health. And the rankings, by the way, are coming out March 29th this year. And there'll be lots of support for that going into that. There's a state team for Ohio. Do you know who your state team leader is? Okay, I'm going to show you how to find that person. So if you have any questions about rankings, you can go to that person. Going back to the model, these factors, based on research and on a wide variety of things that have been going on for about 20 years, looking at what works. About 30% of what contributes to how long and how well people live is health behaviors. So things like, do people smoke? Is it easy to smoke? Are people exercising? Is access to healthy foods? Clinical care, so seeing a doctor is 20%. Social and economic, so where you're focused on education, children in poverty, poverty, income, that's a big driver. This is 40%, contributes almost half to how long and how well people live. And then physical environment like air and water quality and housing and transit are another 10. And the model is if we can find policies and programs that have some evidence base, evidence informed, and then use them to address these factors, we will then have an impact on how long and how well people live in our community. So that's the model. In order to do that, we have to be able to move from the data to action. And that's where the Take Action cycle comes in. And that's in the Roadmaps to Health part of our site. If you get lost in our site, always go up to the orange navigation bar. And so in the Action Center, and I'm going to be wrapping up in just one moment here, we're going to be spending, during this coaching time, you're going to be spending some time in here because there's just so many tools. And you probably want to go into some of the work together tools. And I'm just going to click on that and show you how it's organized now. It's going to look different soon, but for right now, there's 9 major, all these key activities for work together. And work together is not a separate step, it's a step outside of the Take Action cycle because you're always addressing work together issues. And we talked about manage boundaries or boundary spanning leadership. We actually have in that key activity, this is a tool, Defining Boundaries Conversation Guide that comes from CCL, Center for Creative Leadership. And defining team boundaries is also a tool from there. So all you have to do is go into the key activity and find a tool that way. I'm going to go back and also say another way you can get in is by going over here. So that's pretty cool part of the site. And the other thing I want to point out is what works for health, which is the evidence base. We have close to 400 strategies that our team at the university has been vetting for over 10 years now, and we keep reviewing and adding new ones. You'll see that over here. And there's a great 4-minute tutorial on how to use this evidence base and how to find programs and policies that work. So when you get to the point of looking at strategies that you're already using in your community, this would be a good place to go and see, you know, how effective are they and what can we do more to strengthen them and so forth. And is there anything else we could be doing? The last thing I want to point out is we do have webinars that you can go in and see the archives. You can sign up to come to webinars. These are public webinars. And you can also go in and look at some of the prize-winning communities to see what other communities have done. And I'm not going to go there right now. So that's the website. Anything new or surprising? I've been talking a lot. Your turn. Anything new or surprising?
I've really only used the site for the county health ranking, so it was helpful to go through it.
Yeah, when I first joined, actually in 2011, we didn't have the roadmap side. We didn't have the action center. We didn't have coaches. We didn't even have the prize. So yeah, that's been built since 2011. The rankings have been around a very long time because they've been used in Wisconsin for over 10 years. And about 8 years ago, RWJF came to a presentation in New Orleans and saw what we were doing in Wisconsin and said, hey, we want to do that for every county in the whole country. Let's do it in a year. Get the data for everybody. So that's how it grew into a national program. Anybody else surprised by anything or any comments?
This is Ruth. I just have a question. Can you go back to where we see health outcomes?
Oh, sure.
Ladder of information.
countyhealthrankings.org. The approach?
Yes.
This is my favorite
I
picture.
have a question about physical environment.
Mm-hmm.
And I know that health behaviors are very much affected by physical environment in terms of access to healthy food, price. And so does that kind of environment factor into health behaviors, or is that not?
Oh, yeah. Great question, Ruth.
Where does that?
Where does it go? Yeah. So when you go into what works for health, and this might be an area if you want to, when it's your turn to explore and bring back to the team, you might want to look at what works for health. What's really cool about what works for health is you can go in and filter. So I'm just going to take a chance. Let's take diet and exercise as a factor. And we can click on it in what works for health. And then we can filter it to see if there are any. Well, right now we have 7 strategies on housing and transit that will affect diet and exercise. Okay? So that's the place that you would start to see where they come together through policy and strategies. Yeah.
Great.
Okay. All righty. Well, we are at 4:05, so we have, what do you think, Erin? How much time do you want to walk through your piece?
I'm very open. Whatever you give me.
Well, do you want me to make you presenter? And then you can share your screen, or do you want me to advance the slides?
I'd rather you just advance the slides. I wouldn't know what to do. Sorry.
No worries. I hope I can figure it out. So.
Yeah, but definitely a mistake. I requested that ability.
Oh.
All right. So I was trying to give. It's hard. You've done really well with the echo. I'm not sure if I'll make it with the echo. If people mute, will that go away?
It might help. I'm going to mute myself.
Okay. So I was really trying to give, it started out with giving Maureen kind of some background on how the collaborative came together. And Wendy, it was trying to put together kind of the history of what we've been through and how we got to where we were. And So we decided in talking with Maureen that maybe a visual would be helpful, and this is very, it's a very quick effort at creating a very simple visual for what I was trying to get across in my hope for what we might be able to get from coaching. When Wendy and I came to the table for the collaborative, it was about a specific topic, but what we identified was a much bigger issue with service delivery in our area. And so the visual kind of speaks to that. If you want to go ahead and start, I'll just start there. So I said there once was a family, and it was a family living in poverty, and there are a lot of factors that affect that family and a lot of people involved. And so when we came to the table with the collaborative, this was kind of what we were looking at. If you scroll to the next. A social worker decided to help. And the next. Then a doctor decided they would help the family. Then a teacher decided to help. Then a therapist decided to help. Then a dentist and a public health worker and an intern. And these are the families that we serve. There are lots of people trying to help the family, but from a family's perspective, it often feels like a lot of people pulling you in a lot of different directions, and it becomes difficult for any of us to have any traction and for the family to feel success with all of us. So that didn't work, and that was kind of what the collaborative was about, was we thought, well, we will get together and think. And if you go to the next one, we had an idea. The idea was, what if we all started aligning our arrows and moving in the same direction with a family? And you go to the next one. And the hope is that that might be a way, if we were all kind of working and our momentum was all going the same direction, that maybe we could affect change for this family. And the thought was that working together, we believe we can have an impact. And I think that that was what was identified in kind of the needs assessment we did, and the needs assessments that we've looked at. There are a lot of people doing really great things. And I said to Maureen, when we came together, it was Wendy and I saying, you know, for years in Appalachian culture, we've been told we don't have what we need to serve our people. And this group came together around the thought process, what if that's not true? What if we do have what it takes to serve our families? What if we are the experts on our families and our community? And what if we work together to give each other the resources we need and communicate together in a way that's meaningful in order to affect change for that family? And so when I was talking to Maureen, we all, from our different places, have these projects that we're working on that are very meaningful and very valuable. And my comments were never meant to degrade or demean the value of anybody's project, because it's kind of the opposite of that. I believe that all of these are super valuable and that we have some amazing people doing work in our communities. And what my hope was to gain, when the opportunity came and Chris approached Wendy and I about the possibility of getting a coach, that was why I jumped on it. Because I found myself in this place working with a collaborative that we all knew maybe what was needed, but we didn't know how to get there. And And not that we have all of the resources that we need. There are certainly projects that need to happen. But on a larger scale, if all of our projects were aligned, if all of the traffic, as you talked about at the beginning, Jan, was going in a way that we knew how to stay with the flow, and we knew how to get from lane to lane, and we knew how to help families do that, that maybe we could have a bigger impact on our community. And that was what I was hoping for coaching on, is how do we do that? Because I don't know, it hasn't felt like we've been terribly successful on that in our community. When we go from meeting, I love going from meeting to meeting and learning about the amazing things that are happening in our county. And maybe there is a group at the highest level of directors that knows everything that's going on in the county. But certainly us in middle management aren't aware, and even in direct service. I think there's a lack of awareness of how to access those resources and how to make them meaningful for families to get from one to another. So that was my thought behind that visual. Thanks.
Great. Thank you so much, Erin. So before we pivot back to what would success look like, and I'd like to just pause here and ask, are there any ahas or takeaways from this? What's one aha or oh no that each of you maybe got from what Eric is saying? What is your reflection on what you're hearing from Erin? Anybody?
Can you guys hear me? Hello?
Yep.
Can,
I can hear you.
Okay. You know, I think that I agree that we all need to be going in the same direction. And to me, I think we need to have abilities or a platform to do more networking and sharing. I did send out a little email before about June Holly willing to help us do that. I tried to set up that Google Drive, which I feel like is a platform that we can all contribute to, where we can get access to information. So I guess I'm hoping that we can kind of use technology to help share more information. And I don't know if that sounds crazy, but I think us doing this go-to meeting is a step in that direction as well, because it is hard to get everybody together sometimes.
Yeah. Other comments about what you heard, Erin? What did you learn from what Erin said, or comments back to Erin, or others' reflections?
So this is Maureen.
Thank you.
One of the things that Erin helped me see through that brilliant explanation she gave in a visual was I came into the picture about halfway through. So the background had been done, and that's when I entered. So I was a little confused about the goal for the group and then Chris's trip to Florida and the how everything fit together, the coaching, the collaborative, and the rural impact initiative, because I knew a rural impact initiative in another community and it's very different from this one. So Erin's explanation helped me, but the one thing that I really took from it, what helped me put some of what I'm involved in, and I think it'll help all of you too, is that in any kind of collaboration work that I've experienced, there are different levels of communication. I'm using levels for no other reason than it's a descriptor. But what she pointed out to me was that the collaborative was really a group of folks who are direct service middle management folks. They know about quality implementation. They know about working with families. They've done a bang-up job. All of you have done an excellent job in Athens County coordinating and knowing what's going on, and the collaboratives helping the folks doing it in today's world do it even better. For the number of years I've worked in the area, I've always looked at Athens County as one of the outstanding communities as far as that coordinated network in the health community, and always saw it as a model. And as people change in systems, sometimes the coordination or collaboration ebbs and flows. And it looked like this was a time when in this community the current folks in the mix began to engage in a new way again, and that's a real positive. There is also always going to be that directors group that deals with funding and administration and those things and policy, and their vision is much further and longer term, and those in the middle sector, in the service sector, are trying to do, this is the immediate day-to-day problem and we've got to solve it. And I have no answers to the issues, but the fact that we need to recognize that there are different sectors and different roles, and maybe part of what we have to figure out is at which level are we working? Are we continuing to work with the collaborative and as it was intended from the beginning to be direct service intervention and improvement, and then something else or somewhere else the other things happen maybe peripherally. Anyway, that's a long convoluted way of saying that's what I heard.
So I think the point that I'd stop short of is that really the long and short of it is that I will take from coaching the tools for walking a group through a process, whether we use whatever project we use to do that. So I submitted what success looks like to me. To me, success looks like agencies kind of aligning their efforts and moving in the same way and having some sort of communication in place that goes from direct service but also to management on the top. But if we choose a different vision of what success looks like for us, I'm okay with that. I guess what I was telling Jan was my desire was just to be heard, that it did start out different. And I think being heard and having an avenue to be heard is enough for me. If we choose to change the direction and the use of the coach, I'm okay with that. I hope that we'll be able to use the skills that we learn to figure out a system to align our efforts as well.
And I'm just typing away here, so if I'm not capturing what you're saying, let me know, and think of me as the facilitator in the room with the flip chart, only it's through technology with a slide. So anybody can talk. I mean, you don't have to wait for me. Any other observations, reflections, comments, feedback for Aaron?
I mean, I'll just say that, that I think part of the county rankings is that it's supposed to be inter or cross sector, and I think that, yeah, when we start mixing in more people, the original thing starts evolving pretty quickly. But I think everybody agrees that we want to move in that, how do we work together to achieve the goals of helping families and kids. And but yeah, I'm up at this other county commissioner level, and I'm learning a lot about, you know, the down at the, but I feel like I can then help network information to others, you know, like areas of the community. You know, at the last Family Children First Council meeting, you know, stuff about Albany. It doesn't have a place for a family, the family council stuff. You know, like that's the kind of stuff that I like to hear there, and then try to, you know, connect with somebody else that's not involved with this group at all right now, and be able to share with them a need. So hopefully, you know, this is a broadening of things, and it's going to continue to broaden.
I'll go again. So I think the way where I am with this at this point is trying to understand what, and I think this is a question that was posed on one of the earlier slides. What does success look like? What do we want to be able to say at the end of a year, for example, to be and to work towards? And that'll help us kind of frame out the plan. I think, you know, getting everyone to align in one direction makes sense. And then, okay, now how do we figure out what that means in terms of a project that we can work on together? So that's kind of where I am.
Would you all like to go there next? Oh, Erin, you wanted to say something.
Well, I like your thinking, Arian. So what, I like that you're making it practical. So what would that look like?
Uh-huh.
And I wondered, actually I kind of wanted to ask you earlier, I wondered what you thought. Did you have any visual of what that might look like? Because I know you've been working on that with IPAC as well.
I mean, I'm part of this as I don't have a certain vision for this necessarily. I mean, I guess the other part is where exactly do we want to focus this group, and I think that would help us figure out where it is we want to, what specific elements do we want to target. So
how about
yeah, go ahead. Go ahead.
Sorry, didn't mean to cut you off. I was just going to suggest, can I do a check on with the group? Again, thumbs up, thumbs down. Be ready to move on to that question at this point. Erin's given us some background in history, which I think I'm hearing a couple of you say was at least, you know, helpful to see that. Would you be ready to go to this question of what would it look like if, and I'd like you to actually imagine not just 1 year out, but 10 years out, right? What would it look like? And knowing that you're children in poverty, and originally you had talked about, you know, kids with special needs, families with disabilities, that could be a very specific target. But what would it look like if you were doing everything right? What if, and I love this, you know, what if you do have what it takes? I love that. But are you all ready to go there with that question? I'd like to do some brainstorming with you if so, but let me just get a quick thumbs up, thumbs down. Are you ready? Maureen is. Okay, Kathy, can you guys who are on the phone, Kathy, Ruth, Wendy, thumbs up, Wendy, thumbs up, Ruth. Okay, thank you.
Thumbs up, Wendy.
Thank you. Great. So imagine it is 10 years from now, you know, long past coaching. And we're thinking all of Athens County right now, okay? And I come back and I visit you. I'm way older. I'm already old. I come back and I visit you. What am I seeing when I come back? What is really going well? What's happening? And it's around, again, this notion of you have done something. You've moved a major boulder here and worked with your assets and your strengths. How are people working together? What's happening with the children, with the families? What does it look like? What are you showing me? Imagine even you're applying for a Culture of Health Prize. What are you showing me? And I'd like to give you, we're at 28 after right now. I want to give you each like 2 minutes. Just write down some of your thoughts, and then I'll do the scribing again, the flip chart on the slide. Okay.
So are we given permission to think big and
Absolutely, yeah.
Okay.
Think bold, think big, think about how wonderful you already are. Yep, because you've got so many assets and strengths. You've got such a willingness to work together. Let me tell you, that's 90% of the issue in so many places. So, yeah, 10 years.
Can I just say I have two things that I'd like to see.
Can you hold one moment? And Chris, I love your enthusiasm. We'll give people another minute to reflect and think. Thank you. Those of you on the phone, if you want to chat to me when you're done writing, that would be helpful. I can see the others, but I can't see you. I don't want to cut you off, so I'll give you a little more time here. Okay, Ruth is ready. Thank you. Okay, anybody need another half a minute? Wendy, I haven't seen yours yet. Kathy's ready. Wendy, can we go? Okay, great. So here's what I'd like to do for process. Rather than everybody giving everything, one at a time off their list, just to give everybody, one idea at a time, give you each a chance, because I don't know, Chris, you go and it'll be done. We'll have nothing more to say. No, so just teasing you. So yeah, let's start with one idea, Chris, if you don't mind, and then we'll then go to Aaron, then Maureen. I'm just going down the list here. Okay.
Well, I want to get back to like a data point, and to me, a lot of times Athens County is the poorest county in Ohio, and I would really like to see us not be the poorest county in Ohio. And these are, information that comes from Department of Job and Family Services at the state level. So there's measurable data on that. We did just hire a new JFS director, Scott Zielinski, and I'm really excited about Scott, and I think he shares this vision. So that's one thing that I would love to see, and that we could say that we were a part of helping making that happen.
Great. Let's go to Maureen. Let's see. I'm sorry. I'm going to go down the list here. Erin, you're next on my list of attendees. So, Erin, I'm going to pick on you.
So
Just one
I needed
idea.
him to go first. So with that data point, that this collaborative, whatever, this entity has picked 5 initiatives that the entire community is working together toward. That everybody in Athens County is aware of those 5 initiatives. We all know that those 5 initiatives are working toward helping us be no longer the poorest county in Ohio.
Thank you. Maureen, one idea. Oh, you're on mute. You need to unmute. There you go.
Okay.
Yeah.
So I was thinking more along the lines of service provision. So I was saying all families get services in a reasonable time frame. That's just one of a list.
Okay. All right. Let's go to Ruth. Ruth, you might be muted.
Can you hear me?
Yep. Now we can.
Can you hear me? Okay. So technology flows into every home in Athens County like water. It's free. It's accessible. Everybody has it.
Mm-hmm. Thank you.
Thank you.
Wendy.
Yeah, I'm here. Can you hear me?
Now we can. Yep. Uh-huh.
Okay. I keep writing down 3 words: knowledge, access, and trust. And going along with what Ruth says, we got to have the knowledge and we got to get it somewhere. And I think the technology is the start. The access is that it's fine to know about what you need but you have to be able to access it for your children and your families. And then the last one is trust. Folks have got to be able to find connections through relationships to trust that the services are going to meet their children's needs.
Okay. Thank you. Let's go back up to Ariane.
My big one is very much in line with Chris's, but I specified child poverty. So eliminating child poverty in our county.
Okay. Thanks. Kathy.
I was thinking really big. And mine is probably 10 years out. Universal health care for all, adequate housing and transportation, food security.
Okay. All right.
And because this group, one of the, in my understanding previously of this group, one of our goals to work on is early intervention for children, and we're working with that in mind. And I would want us to certainly have that adequately in place for all children in need.
Okay, you just got 2, so we're going to go back around the other way.
Okay.
Early intervention. Yeah. So early intervention programs or services in place for children and families?
Yes.
Okay, Chris, we're going back to you. New idea that hasn't been talked about. Mm-hmm.
Well, I mean, as long as these county health rankings are going to stay around for the next 10 years, I would like to see us improve our rankings. I think that's got a lot of the stuff that Kathy just mentioned, I believe, in there. I think it's such a broad, it's a good data-driven indicators. So I'd like to see us, we're at 76 out of 88 right now.
Mm-hmm.
be nice if we could get to 25 or something.
Knowing that it's not an absolute number, it's relative. So as if all the other counties started improving also, right? So, but it's a great goal. I'm working with a group, by the way, taking my facilitator hat off. They won the Culture of Health Prize, Bronx, and they are 62 out of 62 in New York. And they have a campaign called #not62. And they came back and asked for coaching because they said, we're not done yet. So just, I think you're on the same wavelength. All right, so who was after Chris? That was Aaron, right?
Yes, so the other part of mine is that our agencies will be supporting each other to come up with local solutions to problems, creating less reliance on outside agencies and more support for each other.
Okay. So then we have, let's see, Maureen, you're up. Something new, not on the list?
Yeah. I think there needs to be work among the administrative folks, among the county that works simultaneously as the direct service provider folks plan, so that whatever initiatives are developed, that there's a level of policy and funding mechanisms being worked on simultaneously to fund the work that needs to happen. So I call it a county health plan. Maybe it already exists.
Okay. All right, so I think after Maureen, Ruth, you're next.
I envision in 10 years maybe schools as robust hubs for health, or maybe resource hubs that, you know, a kid not only goes for education, but they have access to medical care if they need it. Parents get resources for child care and any other additional education that they might need.
Okay. Certainly have models for that, a model for that in your own county. Wendy.
Yes, can you hear me?
Yes, thank you.
I'm thinking about countywide transportation services for our folks living in poverty, or services being more accessible in folks' homes. And by services, I mean things that their child needs, identified needs, more of those being brought to the home.
Okay, that's 2. In-home service. Way to sneak it in there, Wendy. It's not child care, it's child support services, because it's the more broader, right?
Yes.
Mm-hmm. All right. And then we are back up to Arian.
My next one focused on ensuring equitable access to healthcare services, but you can probably say that is accounted for in an earlier comment.
Oh, the universal healthcare?
Universal healthcare, yeah.
Oh, okay. All right. I'm not going to repeat it then. Do you have a new one, or are you done with your list?
I had food and, well, I wrote more than 2, so.
You what?
So I guess another one could be eliminating food insecurity. More granular idea.
Okay. I think that might have been mentioned.
Okay.
Well,
so then,
okay, so you had, I think, wasn't that Ruth, you snuck in. Universal health care, adequate housing, transportation, food security.
hey, there it is.
There it is.
That was Kathy. That was Kathy.
Oh, Kathy. All right. Overachiever. Okay.
Okay.
Or non-rule follower, which either way you want to say, right? All right, shall we give Kathy another one? Should we let her go?
No, I already had to.
All right. Chris, do you have another one?
No, I mean, I think the two broad topics I had, if those happened, I'd be pretty happy.
You'd be a happy camper, yeah. Aaron, do you have another one, a new one? Aaron? No. Okay, you're mute. You're on mute. Sorry. Maureen, another one? New one? You're on mute. Maureen, you're muted.
Oops.
Oops.
I don't know if we said it in the other things that are broad goals, but I haven't heard us say there would be something that would bring an adequate number of professionals to provide the service. So increased capacity for professional services like psychiatry and mental health. Well, that is mental health, sorry.
Okay, I'll just put in e.g. mental
Critical
health.
care.
Yeah. Mm-hmm. Okay, great. Ruth, a new one?
New one?
Or you can say pass.
Everyday physical education every day for children is something that I would like to see.
Mm-hmm.
Oh, okay.
And Wendy,
I'm good.
you're good? All right. Anybody in the group, any more new ones? I'm going to go back one so you can see your beautiful vision here.
I do have one. More early childhood education for all children.
Down to what grade or what age?
Well, 0 to 8.
I would make it even more specific if you're okay, Maureen, and say that all children 0 to 8 have access to early childhood education.
Thank you, Erin. Yes.
Because this is a lofty goal we can have.
Mm-hmm. Mm-hmm. Okay. Wow, you guys, how cool. All right. So we're at Q2, and I think what I'm going to do is give you an assignment if you're willing. And that assignment would be, okay, you had these beautiful 10 years out dream, that's your vision. So now step back from that vision, and I'd like you to go through, if you would, if you'd like to use this process, you can use this one or whatever process you want, but imagine it's 12 months out from now, and what's different in your community as a result of the coaching. What have you been able to get yourself to do? What does success look like at the end of a year? How are you going to know along the way what's happened? So is this a reasonable assignment? Can I ask you to take that up and then we come back to this at our next coaching call? Can I see a thumbs up, thumbs down if you're willing to do that?
I feel like we are still so broad that is very difficult to conceptualize how this call, we don't really have a focus.
Right. So I think that you probably are going, is that Erin speaking? Yes. Hi, Erin. So you'll probably have to talk about that some more, right? I mean, what you're doing is you're taking this funnel up here and you're trying to narrow, 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 narrow. And remember, you still have the history and the roots of why you applied, and you have the RIC. So this is one piece of that big highway, right? And so we're gonna be in one, maybe in just a couple of lanes or just one piece of it. So what is that piece? that this RIC coaching challenge is going to help you toward. I would invite you to stay focused on that when you answer what's different in 12 months. The other thing you could do and would be to have this same conversation that we just did, and frankly it was no more than 15 minutes between brainstorming and getting it all out on the slide. So 15 minutes, 10 years out, if just the poverty, the early childhood, you originally said 0 to 8 years old, if just that piece we were doing right, if things were going right, if that can give you a little more, and if you focus on children with disabilities, you know, it's whatever you do, however you peel the onion, you are going to learn from it. So even if you focus just on children with disabilities for this project, all the collaboration and all the pieces you start to connect between people, that's going to make you stronger for working with the greater population. So I do think you have another conversation about this, and then figure out 12 months out what's different because of the coaching. Are you okay with that, or let's?
That's the very conversation that we struggle most with. But if there's somebody else who's able to facilitate that conversation, I'm definitely up. I'm game for it.
Facilitating what I just said?
Right, because you're suggesting we do that before the next coaching call, correct?
And I'm hearing you say, yes, I was suggesting that, and I'm hearing you say, I'm not sure, because we feel like we've gone around in some circles, and I'm not sure if we can do that.
I feel like we go in lots of circles.
Mm-hmm.
Sorry, I don't mean to be negative. I just
No, it's not negative. This is being honest, and this is part of teamwork. Chris, you wanted to chime in?
Don't we have a collaborative meeting next week? Is that correct, Aaron?
I'm
Aren't we meeting next week as the collaborative group?
I'm checking on the date for the collaborative meeting.
Okay. Could we talk about it at the next collaborative meeting?
Yes, I have it next Tuesday at 3:30.
Right. Could we spend some time at that meeting talking about it?
Wendy, I'm open to your feedback.
Yeah, I think that's a good idea for an agenda item. As I was thinking that through, that we should spend our time with a lot of the same players are there. If not all of the same players could be there.
You know, and I just want to say too, Aaron, you're not wrong that this is really big, but if you think about health broadly with, you know, the rankings model, all those different factors, it is pretty broad what you're trying to do, right? I mean, affecting children in poverty, that's huge. We can't just go and, you know, put a few services around families. Can't do just one thing. So it is going to feel big. And so a little bit of my pushback would be to just wonder if maybe it's okay for it to be a little bit big.
I'm fine with it being big as long as we know what it is. And I heard a lot of different ideas, and they're all wonderful, and I would love for that to be 10 years out. Mm-hmm. But I feel like if we don't have some organization to that, mm-hmm. And understand the collaborative's role in that, which I know is what you're trying to help us do, mm-hmm. I just don't understand the next step, I guess.
Mm-hmm. I guess this is Wendy. I'm struggling with that as well. Mm-hmm. Can you help me understand what is the assignment before the next coaching? Mm-hmm. To narrow this down to one goal?
No, I'm not asking you to narrow it down to one goal. I'm asking if all of these things could come true, this is your 10-year vision, are there a couple of goals that I can help you with? Let me give you an example. You've got here that we've picked 5 initiatives that everybody's working toward, and everyone's aware of these. So a coaching goal that I could help you with is to help prioritize what those 5 initiatives are based on data and community feedback and your strengths and so forth. That would be a coaching goal. Let me put another one. Let's see. Administrators have put policy and funding in place to support the work. There's a county health plan. I could help you put together a county health plan. That's obviously related to having 5 initiatives. I could help you with strategic planning. And really what you're talking about there is developing a plan that's got health in all policies. That would be a coaching goal. Chris?
There's already, yeah, there is a county health improvement plan process.
Yeah, I just picked that one.
It's like, I think if we can just even spend some time talking about what other things are going on in other places, we might realize that some of this is already happening.
That would be a good conversation.
Some people just don't know about it because we're in our little silos.
What if you took these 2 slides, just took this piece to your collaborative next week and did exactly that, just had a conversation about, just like we did here, have them help you with what would make sense. Like I pulled out that administrators have a policy and there's a plan. Chris says there is a plan. Well, that's part of the conversation. Maybe that wouldn't be your coaching goal then. Or does the plan need to get strengthened? Or I don't think it's a bad idea to take this list back to your collaborative because you really are kind of a subset in some ways of that collaborative. Not all of you may be part of it, but you certainly, that's a really critical group here, right?
And if I can serve as sort of that neutral sort of mini facilitator in between these coaching sessions, Erin, I'd be happy to help during the collaborative meeting to just kind of serve as the role that Jan's serving right now, just kind of being the, just kind of push people along to try to help people through the conversation. And maybe I'll bring some big paper and put it on the wall. We can work through these each of these items and just kind of get a brain dump from the collaborative and see if we can make some decisions on how we hone down on some of these ideas. So I'm happy to do that if you need sort of that someone to fill in that role.
Yeah. I'm just trying to identify what doesn't feel good right now. So I'm feeling it, now I'm trying to find the words to go with it. I think it feels backwards, and maybe not. I just want to reflect on, do I feel okay asking the collaborative who's not part of the coaching to come up with the areas that they want coaching help with? Because that was kind of the part that rubbed a little bit wrong in the first place.
That the collaborative came up with the coaching?
Well, that the collaborative isn't getting the coaching. And so now we're asking them to, so I'm just trying to make sure that...
Who is from the collaborative that's on the coaching team right now?
I think all of us.
If we're all able to be there, that's great. That's great.
Okay, but it's all of you on the coaching call right now are part of that collaborative, and then there's some others not on the coaching team that are part of the collaborative. Is that right? I'm just trying to understand. Is that correct?
Is everybody able to be at the meeting next Tuesday? Does anyone go to the coaching call?
Yes.
Okay. All right, then it feels a little better. Thank you.
Okay. So, great. All right, good. And what I was going to suggest is you've really kind of started the first step of what's called a logic model. And we have a really wonderful process in the Action Center called tierless logic models. Logic models without tears. Is anybody familiar with logic models?
Very
Yeah.
little.
Maureen, have you cried when you've done logic models? I've heard a lot of people cried. A lot of blood and tears have been shed.
I was going to ask you if it was T-I-E-R or T-E-A-R.
TEA.
Okay.
It's a really, I'll put it in the summary notes for you all, and Arian, if you're willing to facilitate, that would be awesome. But it's really well laid out. It's basically a facilitator guide, and you've done the first step here, and if all of you are in the collaborative, then maybe it's just a question of getting the others in the room to also weigh in with their ideas of what would look like 10 years out. You're really talking about building a culture of health in Athens.
I think that will help that part as well.
Now I'm getting a lot of feedback. I don't know why. Somebody needs to mute, I think. Okay. Erin, could you talk again?
But I think that helps it feel a little bit better if we're asking them to participate in that part as well.
Yeah, not just react to. Yeah. So add to. But if you have a process that's laid out and it's got flip charts and the whole thing, and it's really nicely designed, I'll put it in the summary notes. You can take a look and see if that would be helpful. Okay.
And
We may not have a
to facilitate that. I think it would be helpful. Thank you.
Great. Oh, good. All righty. Well, we're coming to a close. It sounds like we have a decision. Arian is offered to be facilitator. I'm going to send you all the logic, tierless logic model process. It'll be in the summary notes. Aaron, feel free to call me if you have any questions about it, of how to facilitate it. Okay. And for next steps, then I'll send you the summary notes. And who took notes on today's call again?
I did, Maureen. I'll send those to you, right?
Yeah, that'd be perfect. Whatever you've got, and I'll incorporate them into my summary notes. And then who would like to take one part of the Action Center next time we have a coaching call? It'll be just like 5 minutes into, the website. Show us a tool or a part of the site that you really think will help this team. Who would do that first? Once you've done it, you don't have to do it twice. All right, Chris, you're up. And then I'm also going to send you all a link to a pre-coaching survey that's part of being involved in our coaching program. I'm going to ask that you finish it by the 17th, and it's anonymous, but you fill out that survey, and that gives us a good sense of where you start. Next call is March 9th, 3:30 to 5 Eastern Time. So for next steps, I've got those two pieces, and then we've got Arian doing the facilitation. This was my checkout for you. If somebody could mute right now, I'm getting a little feedback. If you all can mute, thanks. So just be thinking about your hopes, fears, and concerns going into the coaching experience. I think rather than doing this as a reflection, maybe we'll start with this as a check-in for our next call, because you'll have a little better feel for, and you'll be able to have sat with this first kind of formal coaching call, and you will have done the work on visioning and thinking that through, and we'll start with that as a check-in next time. Is that okay with everyone? I want to end on time, so. All right. Awesome. You know, you guys are so wonderful. You're honest with each other, you're giving each other space to speak, and you're taking the time to do this right and be on the same page together. So thank you very much. I want to really recognize that. Yeah. Not every team is like that. So take credit where it's due. All right. I'm going to stop the call and have a great weekend all. I'm available, Arian, next Monday. I won't be in tomorrow. So, okay. Take care, y'all. Fantastic.